Good evening, I'm Andrew Cheng.
And I'm Adrienne Arsenault. Tonight, as COVID cases surge, a bittersweet homecoming. A newborn boy leaves the hospital as his mother stays fighting for her life.
She might end up needing, permanent care for the rest of her life.
A family tragedy unfolds as cases skyrocket in BC's Fraser Valley.
Also tonight, a scathing report rips into the Ontario government's pandemic response.
The systems that people needed weren't in place.
But the Premier is pushing back.
Stick with the job that we hired you for.
The Trudeau government takes heat over its vaccine plans.
So far, we know that Canada will receive its vaccine only after the United States, the United Kingdom, Germany, France.
We look at who's willing to roll up their sleeves and who isn't.
I am not going to be the first in line for this, no.
How doctors are managing vaccine hesitancy.
Plus, Meghan Markle starts a conversation. A simple question with a not-so-simple answer. Are you okay? This is The National.
It has been a tragic 24 hours in British Columbia as the province continues to fight against the second wave of this pandemic.
Today, it reported its highest ever number of new COVID-19 deaths. And with hospitalizations also hitting a record high, worry is growing. Much of it focused on one area. Of the province's 738 new cases today, more than half come from the Fraser Health region, which includes a number of communities just outside Vancouver. Briar Stewart takes a closer look at what's happening there and the devastating impact for one family.
This is not how Dave McIntosh envisioned his trip home from the hospital with his new son. He's joined by his sister as his wife Jillian is on a ventilator fighting for her life.
They're doing everything they can in there, but there's so much damage done to her lungs, we don't know. She might end up needing, permanent care for the rest of her life.
Their son was born 2 weeks ago by an emergency C-section after his wife contracted COVID-19. She remains in a medically induced coma and has never seen her own son.
With no change in my wife, having this little bit of sunshine, a little bit of happiness to add to what's going on right now. But we just want Jill to get better and start showing some improvements.
Jillian McIntosh is one of the more than 60 people in the ICU with COVID in BC, and today the province saw a record number of deaths.
Sadly, in the last day, we have an additional 13 people who have died from COVID-19 here in British Columbia.
The McIntoshes don't know where Jillian got the virus, but they live in the Fraser Health region where there's significant community transmission. But specific data beyond that isn't available.
So while we are hearing rumblings that, a lot of it is coming out of particular areas, affecting particular communities, we don't know exactly why or how it's happening yet. And we don't have that data to help inform us.
The province has noted that transmission is happening in the South Asian community, but can't quantify it further because they aren't keeping race-based data. Public Health has been reaching out to different communities, but some believe the messages aren't clear enough.
Some of the health orders have been confusing or have mixed messages for even native English speakers. Then you can imagine for people for whom English is not their first language, there could be some missed communication or mixed communication there.
And Briar, Dr. Bonnie Henry also had to correct a whole bunch of data today?
Well, that's right. Officials say that over the last 9 days, there was an error with their system, and this led to both an over and under reporting of cases in Fraser Health. So, for instance, yesterday it looked like there was a big provincial spike, 941 cases, when the true total was just under 700. But still, the number of cases in Fraser Health is rising, and to keep up with the volume, the province has hired a couple of hundred contact tracers, and 70 are being deployed from the federal government, Andrew.
All right, but good to get that clarification. Briar Stewart in Vancouver tonight. Thank you so much. Now, those growing COVID numbers are likely fueling British Columbia's other health crisis, a surge of illicit drug overdose deaths.
Once again, that number has become unacceptably high, with 162 people in British Columbia dying in the month of October.
That is more than double the number recorded in the same month last year. BC's chief coroner says the pandemic is making the street supply more toxic as dealers add unknown agents to make up for lack of supply. The province now has an average of 5 fatal overdoses a day.
One day after Alberta declared a public health emergency, the province recorded a tragic milestone, a total now of 500 deaths. Meanwhile, its case numbers also remain really worrying. Today, 1,265 new infections were added. That's up from yesterday, as are hospitalizations. And today, Saskatchewan announced its latest plan to stop its rise in cases. This, while it reported 164 additional infections. Even with those troubling numbers, the new rules are seen as more of a tweak than a tightening. Bonnie Allen explains.
At 69 years old, John Hanna usually spends his winters in Arizona, but unable to travel south, he's driving a taxi.
Most days I start at 5 o'clock in the morning and sometimes go till 8 o'clock at night.
That's 15 hours a day, 7 days a week. Long shifts, trying to eke out a living as fewer people demand his services.
I haven't taken many people to bars, but I've taken them to the casino and restaurants.
He was worried additional restrictions would shut down businesses.
How far does it go?
Not as far as many were calling for.
Can you hear us, Premier?
Premier Scott Moe, in self-isolation awaiting a COVID test result, spoke by video conference.
We don't believe the solution is another wide-scale lockdown.
Moe resisted pressure from hundreds of medical professionals who had called for some shutdowns. Instead, he reduced capacity inside most businesses. For example, just 30 people inside casinos, down from 150. Moe insisting most businesses are operating safely.
So it would be terribly unfair, and it would have a huge negative impact to close down all of those businesses and put thousands of Saskatchewan people out of work.
The only thing suspended, team sports, blamed for fueling infections in schools and workplaces.
They were certainly more timid than I would have expected. We didn't come out of this press conference with a clear indication of what might trigger something more aggressive.
Already the virus has moved into long-term care homes, jails, and shelters. Kyle Gunderson had COVID-19.
Moe didn't even say, don't go out if you don't have to. He said, maybe don't go out if you don't have to. And I think that's the messaging that bothers me the most.
It's political, I would think.
John Hanna is relieved the new measures are not tougher. He's not worried about his health. It's his shrinking pocketbook that scares him. Bonnie Allen, CBC News, Regina.
Now in Ontario, the Premier is urging the province's families to think smaller when it comes to Christmas celebrations.
The safest way for any of us to enjoy the holidays, no matter where we live in the province, is to celebrate with our own households.
So those living away from home, like college and university students, are being asked to isolate or reduce close contact with others for up to 2 weeks before going home, while anyone living by themselves can join another household so they don't have to be alone. But Doug Ford's handling of the pandemic did come under more fire today, this time from the province's own spending watchdog. Auditor General Bonnie Lysyk says delays, conflict, and confusion bogged down the early response to COVID-19. And the report comes as another 1,300 Ontarians tested positive. But as Ellen Morrow shows us, Premier Doug Ford is telling his Auditor General to stick to crunching numbers.
I miss him so much. I really do.
Kathy Park's father, Paul, died of COVID in long-term care on April 15th, a week after the Ontario government ordered care home workers to wear masks. By the time the province acted, 119 long-term care residents had already died, according to CBC data.
There's no guarantee that he would still be alive, but he would have had a better chance had precautions been taken sooner.
From that slow move on masking to long wait times for test results, Ontario's Auditor General slammed the province's COVID-19 response.
Is in a time of crisis, the systems that people needed weren't in place.
The AG found Ontario was slower to act than other provinces, with a decision-making process that was overly cumbersome, not led by public health expertise, and plagued by delays and confusion. The Premier fired back.
Don't start pretending you're a doctor or a health professional, because I can tell you, you aren't.
But health professionals aren't always leading the response, says the AG, who found Ontario's pandemic command structure is overseen more by bureaucrats than Chief Medical Officer of Health, Dr. David Williams. Not so, said Ford.
But to sit in the office and throw hand grenades at Dr. Williams and his team and the Minister of Health is totally unacceptable.
The health minister said no province is perfect and points out,
outside of Atlantic Canada and the territories, Ontario has the lowest rate of COVID-19 cases per 100,000. These are the facts, plain and simple.
Still, Ontario is deep into the second wave. Cases rising, Toronto and neighboring Peel region locked down. Kathy Parks hoped lessons would be learned from the first wave, but she fears not enough action has been taken.
For a lot of family members, we've been so let down for so long, and things haven't been done for so long. It's discouraging.
Ellen Morrow, CBC News, Toronto.
Now, police in Toronto have laid several charges against a restaurant owner who continued to defy public health orders for a second day in a row now.
I was nice to the guy yesterday. But buddy, let me tell you something, you need to shut down. You're putting people's lives in jeopardy.
The premier said the owner's actions are irresponsible and ridiculous. Toronto's lockdown started on Monday, but the restaurant had become a focal point for people opposed to the new measures.
We lost jobs, we have children to feed.
Toronto's mayor says he will take further action if the owner tries to open up again tomorrow.
The Prime Minister came under fire again today after revealing Canada will not be first in line to get a COVID-19 vaccine, despite ordering millions of doses because Canada won't manufacture them.
The combined population of countries ahead of Canada in the distribution line is almost 2.5 billion people.
Saskatchewan Premier Scott Moe chimed in, saying the revelation was concerning. Trudeau said yesterday the countries where the vaccines are produced will likely get them first, including the United States, Germany, and the UK. New restrictions take effect at midnight in Nova Scotia. They include a ban on visitors to long-term care facilities. Volunteers and designated caregivers are exempt, though. The province registered 16 new cases today, all in the Halifax area. So as Kayla Hounsell shows us, people there are flooding rapid testing sites.
Next two people can come into the lobby.
By the time Dr. Lisa Barrett opened the doors of this pop-up rapid testing site, the wait was well underway.
We got here about an hour and a half ago.
How do you feel about that?
I'm cold. It's cold out. But I'm glad I'm not all the way at the end of the line. That's a long ways back.
It was indeed. The lineup wrapped around the building and multiple city blocks. It went on, and well, you get the idea.
Yeah, it's super long, but it's worth it.
Volunteers have stepped up to be trained to administer COVID-19 tests to people who have no symptoms.
Just want to make sure I'm negative, make sure I'm not getting anyone else sick, doing my part.
Nova Scotia Public Health says this kind of asymptomatic testing is critical as the Halifax area is experiencing a spike in cases.
We're keen to help the government understand how much virus is really in our community.
Yesterday, 604 people were tested at a pop-up rapid testing site like this one, and only one was positive.
And so that, to me, is a really big win. Each person that we find early and we're able to tell them that they're positive so that they can do the right thing and isolate, we have the ability to potentially divert hundreds of infections at a time.
Most of the cases in Halifax are among young people. The government is asking anyone who's been to a bar or restaurant after 10 p.m. to get tested, but not with a rapid test, which is less sensitive.
If you have a high suspicion that you've been in a place that has COVID directly, or you think you have symptoms, you need to get the gold standard lab-based test.
Asymptomatic rapid testing is just another tool to prevent the spread.
If it keeps everybody safe and can get us back in that bubble again, that'd be great.
And around here, getting back in that Atlantic bubble is the real gold standard. Kayla Hounsell, CBC News, Halifax.
President-elect Joe Biden called for unity in his Thanksgiving address today, particularly in the face of the pandemic.
I know the country has grown weary of the fight. We need to remember, we're at war with a virus, not with one another, not with each other. This is the moment where we need to steel our spines, redouble our efforts, and recommit ourselves to the fight.
More than 180,000 new cases were reported there today. That concerning climb continues. But grimmer still, the number of deaths. More than 2,000 people died for the second day in a row. The number of deaths is up 30% in just the past week. And that's where the U.S. stands, heading into a potentially super spreading event, Thanksgiving. Today, millions of Americans are doing precisely what the CDC had pleaded with them not to do. Katie Simpson brings us the scene at a busy airport in Washington.
Taking the TSA on the other side of the wall.
Millions of travelers are pressing ahead with holiday traditions, even as the country goes through its worst ever surge in new daily COVID cases.
Everything's been planned months and months before, so, you know, gotta go.
Honestly, I'd rather be there than here alone.
Travelers unfazed by the request from the Centers for Disease Control to put off plans this year.
Did you think twice about your trip when the CDC asked people to stay home for Thanksgiving?
No,
Why not?
it's none of their damn business.
The number of passengers in this airport is about half of what it typically would be for this time of year. Public health officials have been pleading with Americans to stay home, pointing to Canada's Thanksgiving experience in October as a warning.
They celebrate it much like we do, families around a table coming from all over in airports just like that. And they had an explosion of cases in Canada.
At least one new trend suggests some people are taking the warnings seriously.
We sold more turkeys this year than in past years, but smaller sizes. Here you go, James.
Thank you so much.
James Irwin is going to a scaled-back dinner for 5.
We've been quarantining for 2 weeks. This is the first time I've been outside, and it's only to come pick up these groceries.
Another trend, Thanksgiving takeout dinner for 1.
Well, we've sold 80 orders, which is, for a small place like us, that's a lot of lobster.
It's been a struggle to keep this seafood bar open, and the head chef fears a post-holiday COVID spike is coming.
It just makes the road a lot longer until we get to the end of this. And it's extremely frustrating. It's very frustrating.
The sacrifices of some this holiday, those who chose to stay home, may not be enough to counter the indulgence of others mingling about. It will take about 2 weeks for the country to find out. Katie Simpson, CBC News, Washington.
President Donald Trump pardoned his former national security advisor Michael Flynn today. Trump announced the move over Twitter, congratulating Flynn, wishing him a happy Thanksgiving. Flynn twice pleaded guilty to lying to the FBI about his conversations with Russia's ambassador. He was the only member of the Trump administration charged in Robert Mueller's Russia probe. A deadly conflict in Ethiopia continues with a standoff between government forces and regional fighters. This is happening in the Tigray region in the north. Caught in the middle of the conflict, tens of thousands of civilians. As Renee Filipponi tells us, there's growing fear about what will happen next.
For weeks now, Ethiopians fleeing conflict have ended up here in refugee camps on the Sudanese border.
If we were in our city, it would be very, very, very dangerously. So right now here, at least we are safe.
The Ethiopian government has been battling the Tigray People's Liberation Front, or TPLF, since early November. Prime Minister Abiy Ahmed has called it a law and order operation, claiming the TPLF attacked a military base and are undermining democracy. The Tigrayan forces deny it and call Ahmed's government illegitimate. Video from the region is sparse, but new satellite images show the government military taking control of an airport in the region. It says government forces are now surrounding the capital of Mekelle. Another image shows long lineups for fuel in the city. The government has been clear it won't negotiate and issued a surrender deadline which expired today. But with a communication blackout, little information is getting out of the region, which has made it difficult to confirm statements from either side.
We've seen an Ethiopian colonel come out and say that there will be no mercy. On the other side, we've had the TPLF leadership come out and say that they're prepared to die. This is the kind of rhetoric that is extremely worrying.
In a statement today, Ahmed said the international calls for de-escalation are an unwelcome and unlawful act of interference. But there are concerns about a looming humanitarian disaster. There are more than 40,000 people already displaced, and the number is climbing. Meanwhile, supplies are running out. Renee Filipponi, CBC News, London.
Meghan Markle has revealed a personal loss in an emotional op-ed. She had a miscarriage this summer.
Yeah, I think it's good that she spoke about it. I think it takes a lot of courage, and I think it is the right thing to do.
Still ahead, how her story is empowering other women to share theirs. And her simple question during complicated times, are you okay?
Plus, exploring why some are hesitant to get the vaccine.
It's not that I'm not worried about it. I don't really feel that that I need to jump to getting the vaccine.
What Canada's top doctor wants worried Canadians to know.
And remembering a soccer legend.
He was, a truly magical player who could single-handedly, change the course of matches for his team.
We're back into Welcome back. The World Health Organization has published new fitness guidelines amid a pandemic that has effectively turned all our lives upside down. And these guidelines call for more physical activity. But just how much exercise are we talking about? As Greg Rasmussen explains, it's no sweat.
It's an up and down slog, a stair-climbing challenge called the Coquitlam Crunch.
I'll go rain or shine, and it's mostly rain, but an umbrella.
Getting in enough exercise as winter closes in might seem daunting, but
the hardest part about doing any exercise is starting. Once you're out here, it's a breeze. It's just hard to get off the couch. But once you get the first step off the couch, it's easy.
So what do you guys want to watch?
the new study says exercise is needed to counter all those increased hours spent on our backsides. Extensive sedentary time is linked to serious ill health and a heightened risk of early death. But 30 minutes of moderate physical activity per day lowers the risk. 44,000 people wearing fitness trackers were followed during the study, leading to the new recommendations with the goal of improving the fitness of people around the world.
Some is great, more is better.
This doctor says you don't have to work up a sweat, just move.
Walk the halls of your house. Walk from the kitchen to the living room and back and do that 10 times, and that's good.
Unsere Couch war die Front. One COVID-related obstacle, government campaigns, such as this German tongue-in-cheek ad glorifying couch potatoes. But too much couch time has a price, and staying apart without falling apart means Canadians need to figure out new ways to work in exercise after a day in front of the computer screen.
At the end of the day, which I'm going to do shortly, I'll go for a brisk walk with one of the kids, just to be that kind of, right, the day is over and I'm consciously planning to integrate physical activity into my day.
The risk is pandemic-related couch potato syndrome. But this latest study is a reminder, one soggy step at a time can be the antidote. Greg Rasmussen, CBC News, Coquitlam.
Well, up next, a look at vaccine hesitancy, why some Canadians say they won't be rushing to roll up their sleeves, and what's being done to get them on board as soon as possible. But first.
Security was tight today as a forensic team arrived at a home near Buenos Aires. Soccer legend Diego Maradona had died of a heart attack. Regarded as one of the greatest players in the history of the game, he became a global sensation after leading his country to World Cup glory in 1986, due in part to his hand of God goal against England in the quarterfinal.
Maradona still has it, lays it to Valdano. Maradona gets jumped, and it's a goal.
During his era, he had no equal. He was, a truly magical player who could single-handedly, change the course of matches for his team.
Despite his short stature, just 5'5", he became a giant in the sport with a legendary ability to just read the game. He would go on to play for big clubs in Europe. But off the pitch, his love for soccer was second to his appetite for drugs. His health suffered from years of abuse, and earlier this month, he had surgery for a brain clot. Tonight, soccer fans around the world are mourning this loss. Diego Maradona was 60 years old.
A few months ago, a vaccine for COVID-19 felt like a distant goal. Now, each week seems to bring more good news and gets us a little closer to the end. But for many Canadians, there's no rush to be among the first in line. Joanna Remiliotis has more on what is shaping that skepticism and what it could cost for all of us.
We know that without a vaccine, we don't get through this pandemic.
It's the only way out of this.
We are looking forward to being able to vaccinate Canadians in the coming months.
And yet, when it comes to a COVID-19 vaccine, many Canadians are not looking forward to one. Many are simply not sure which way to go. Vaccine hesitancy. It's quietly building and putting public health at a pivotal crossroad. Dr. Theresa Tam is Canada's Chief Public Health Officer. She spoke to us from Ottawa about what she says is a top priority.
How critical is it to capture that hesitant group?
It's extremely critical. It is really important that as many people get vaccinated as possible to protect themselves but also others who are at higher risk.
Tam has been a sobering face of this pandemic. As the head of the Public Health Agency of Canada, she's tasked to inform, and now more than ever, to persuade.
We know that some people have made up their minds and others have not. We call the group that haven't made up their minds, who needs more answers to their questions, the movable middle.
Much of the reluctance is more reasonable than rigid. Skeptical rather than suspicious.
I'm definitely not an anti-vaxxer by any means. I believe that they have their place. There's diseases that we were able to eradicate as a result of vaccines and vaccination.
Tanya Hales has made sure her son is up to date with his immunizations. But those shots have been around for decades, unlike the COVID vaccines on the near horizon.
I want to hope that there's going to be a time where outside opens again and we can gather without fear. And I know that a vaccine is going to be the first step towards people feeling comfortable with that. But I don't even like early tech, right? When a new phone comes out, I'm like, I'll wait until it works out the bugs and the kinks. And I'm kind of feeling the same way when it comes to the vaccine.
So you wouldn't be the first in line?
I am not going to be the first in line for this, no.
Not the first in line, maybe not in any line. Despite the rising number of infections, the relentless toll on healthcare, not to mention pandemic fatigue, public health numbers suggest up to 35% of Canadians are unsure about getting a COVID-19 vaccine when it's available. And that number could go up.
Vaccine hesitancy is a real and persistent problem in Canada, and it does appear to be growing somewhat.
Angus Bridgman is a researcher at the Media Ecosystem Observatory in Montreal. The group is tracking vaccine hesitancy in Canada and the misinformation that seems to be shaping it.
Vaccine hesitancy is not inherently misinformation. It can contain misinformation and often does, but is itself not. You can have very legitimate concerns about a vaccine and not be sort of anti-science or anti-intellectual.
The so-called movable middle may not be anti-vaxxers, but a barrage of misinformation online around everything, from the accelerated speed of vaccine development to pauses in vaccine trials, can fuel mistrust.
Repeat exposure to misinformation, to misleading content, can change opinions. Even if sort of the first time you see something that's very misleading and you go, oh, that can't possibly be true, you have generally a positive perception of vaccines. If you see it over and over and over again on your social media feed, there is this seed of doubt that will creep in. It's sort of a familiarity effect, if you will. And over time, yes, that can certainly change people's minds.
Hi, I'm Dr. Paul, and I'm so excited to be a member of Team Halo.
It's why scientists from around the world recently waged a social media campaign of their own to debunk vaccine myths. Public health officials in Canada are working on one too, aimed especially at young people who are on social media the most. The strategy includes enlisting influencers on YouTube, putting the word out on gaming platforms, as well as testimonials from younger Canadians who got infected with the virus. Tam says that group is especially important.
Some of the insights that we gain is that those who actually get their information on digital social media platforms are less likely to get vaccinated than those who follow traditional media. So I think that's why it is a very key pillar of our approach in the days and weeks and months ahead to be able to get that group of people the information that they need to get vaccinated.
Oh. How you doing, big guy? But while public health officials are raising the alarm, Lisa Cottingham doesn't feel a personal sense of urgency. She's not against vaccines. Her son is up to date with his shots, but she'd just rather wait and see.
I feel like it's more important for people that are vulnerable or senior citizens to have the vaccine because they're more susceptible to COVID itself. I'm a normal, healthy adult. It's not that I'm not worried about it. I am, but I don't really feel that that I need to jump to getting the vaccine.
And why is that?
I feel like there's not enough information about it, and I'd rather wait and see. I'm happy to wear a mask. I'm happy to socially distance from people, and other people's health is important to me. I just feel like I'm not in urgent need of this vaccine.
But if hesitant Canadians become holdouts, that poses a risk to herd immunity. With no other health measures in place, experts estimate around 70% of the population would need to be vaccinated to stop the virus from spreading.
This is a nasty virus, and it's true that most people will survive and, not have a bad case. But, if 1% of the Canadian population gets a severe infection and 0.1% of them die, you're talking about a lot of deaths. You're talking about 400,000, 300,000 deaths. I'm not willing to, accept that type of mortality from an infectious disease. To me, that's a high priority for vaccination.
Dr. Scott Halperin is with the Canadian Immunization Research Network in Halifax. He's involved in COVID vaccine trials and is also working with public health officials to identify and address Canadians' top vaccine concerns. The speed of vaccine development keeps coming up.
When somebody says, well, it takes 10 to 15 years to, develop a vaccine, that's correct. In the first several years, 4 or 5 years, is understanding the virus itself and understanding what the important antigen is. So what's protective? What does the immune system do to protect against it? A lot of that work was done before because this is another coronavirus, but we already had SARS, we had MERS, we had the seasonal coronaviruses. So we knew a lot about this.
Halperin says that earlier research gave vaccine makers several years of a head start. An unprecedented global collaboration streamlined administrative steps too, shaving several more years off the process. Ultimately, Halperin says, it comes down to a collective responsibility.
I think if we want to get beyond restrictive public health measures, the population is going to really need to buy into vaccines, protect themselves and to protect their communities. The same reason why we wear masks, we're doing that to protect other people. That's the same thing with vaccines. The vaccines are to protect yourself, but they're also there to protect others. And it's very important for the community to buy into that we're all protecting each other by doing this. And by doing that, we can get back to a normal life.
Normal life. That hinges on Canadians' acceptance of a vaccine and their trust in one. Tam says that will be a key message going forward.
Our Health Canada regulators, I would say, is one of the most stringent regulatory authorities in the world, and they will not approve a vaccine unless they're satisfied that they've seen the data and that the benefits far outweigh the risks. So I think that's really important for everybody to understand. Even after the vaccine rolls out, there is a massive work underway to make sure we monitor the vaccines on an ongoing basis as they're being provided to Canadians as well.
The road ahead will be a cautious one. The hope is the shadows of hesitancy will only last so long, on the promise of better days ahead. Joanna Brumaliotis, CBC News, Toronto.
And we do have more on this story. On the other side of the break, we're going to talk to a doctor whose job it has become to help guide people through their vaccine concerns, fears, feelings. She works in a vaccine hesitancy clinic. What her conversations are like with her patients right after this. Welcome back. Most Canadians won't need convincing that a COVID vaccine will be worth taking once it arrives. But as you just heard, there are entirely legitimate reasons to have doubts or to ask questions. So to answer some of ours, we have Dr. Cora Constantinescu joining us, an infectious diseases specialist who works at the Vaccine Hesitancy Clinic at the Alberta Children's Hospital in Calgary. And doctor, I didn't even know a place such as yours even existed. I mean, who gets referred to you exactly?
We have made it into more of a streamlined process and have actually gone out in the physician community and told them that we're here to support them as they refer their patients into us.
And then do you see it as your job to sort of convince people to get vaccinated?
I see it as my job to support people as they're making the decision to vaccinate.
So how does that conversation sound? I mean, where would you even begin?
I start every time reminding myself that at the heart of each and every vaccine hesitancy appointment, there is a parent trying to make the best decision they can for themselves and their family. And it actually takes quite a lot of courage to come in because they're battling a lot of fears and misinformation and overall a lack of trust. So we spend quite a lot of time building rapport and trust with each family, understanding more about them so that we can actually personalize and tailor the communication and the message that we give to them about the vaccinations. And then we work closely with public health where they go ahead and actually administer the vaccine.
And that's striking that you would say that there is this kind of lack of trust. I mean, how would you even begin to advise, I don't know, like a provincial government, a local government, or the federal government to create that or to build that?
Yeah, so I really think that when we think about trust, we have to think at the personal level and at the population level. And at the personal level, it goes back to this idea of putting it into perspective and understanding what the benefit of the vaccine and the danger of the disease is to each of us. So when it comes to COVID, for example, I would encourage every Canadian to think of what this pandemic and what they have done for this pandemic and what this virus has taken away from them. So it might be that some have lost loved ones, others have lost their social interaction, the ability of their kids to go to school. There is a cost to each and every one of us, and therefore there is a benefit to each and every one of us. And then we all have to go and take this vaccine so that we can show that we're indeed in this together. And then when we move at the population level, it's really important to start building this trust. And it's a hard task to take on because you have to consider the complexity of human behavior, especially around COVID-19. And our healthcare institutions can't do this alone.
I don't want this to come across as a callous question, but how do you know what you do works? Because you're not the one administering vaccines, right? Do you track your success rate, so to speak?
So depending on how we look at it, it's anywhere between about 50 to 65% that patients will go ahead and have a vaccine after they've attended our clinic. And in the vaccine hesitancy world, actually that's quite successful.
This has been an interesting conversation, to be sure. Dr. Constantinescu, thank you so much for your time.
It was a real pleasure to be here. Thank you for having me.
Oh, really interesting. After the break, reaction to Meghan Markle's message about personal loss. She asks readers, are you okay? Well, tonight we turn the question back to you. Are you okay?
I think it's very, very important to realize or remind yourself that this is going to pass. This is not forever.
Our own virtual national check-in. Welcome back. There was a very personal revelation from a very public figure today. Meghan, the Duchess of Sussex, revealed she'd miscarried her second child. And Tashana Reid tells us through that story, she's urging people to ask each other a simple question.
The Duchess of Sussex, in her own words. In a personal piece in the New York Times, Meghan shared her story of grief after losing a child in a miscarriage this summer. I knew as I clutched my firstborn child that I was losing my second. Losing a child means carrying an almost unbearable grief, experienced by many but talked about by few. She ended up in hospital with husband Harry by her side. Royal watchers say Meghan, no longer bound by restrictions of being a senior working royal, is using the power of her voice.
She has more latitude now, and she's using that scope to put the attention on issues that clearly matter to her.
Yeah, I think it's good that she spoke about it. More women need to. I think it takes a lot of courage, and I think it is the right thing to do.
Midwife Melanie Mart-Smith says this open dialogue can help break the stigma.
The more we talk about this, the more we can actually support the people for whom this has happened to.
The Duchess reflected on the broader toll of 2020, from the unimaginable loss of the pandemic to the police killings of Breonna Taylor and George Floyd. Meghan wrote about the importance of this now viral moment.
I don't know what the impact on your physical and mental health of all the pressure that you clearly feel under.
Thank you for asking, because not many people have asked if I'm okay.
Asked a simple question that meant so much. Now she is encouraging people to ask their loved ones that same question. Psychotherapist Roxanne Francis agrees.
People are struggling with their mental health now more than ever before, I would believe. And I think that we need to create a sense of community where we can take care of each other and help each other hold space. So it definitely is really important to ask, are you okay?
Meghan ended on that question and words of hope, we will be. Tashana Reid, CBC News, Toronto.
An interesting thing about that question, are you okay? That's something everyone can ask those close to them right now. In the before times, we used to pose questions like that to you, too, in our red chair. In COVID times, we're keeping the concept, inviting people via Instagram to sit in their own chairs today and think hard about the answer.
So my name is Emily Clark. I'm 30 and I'm from Oshawa, Ontario.
My name is Eduardo Vargas. I live in Montreal and I'm 41 years old.
My name is Pooja Patel. I'm 21 years old and I live in Montreal.
Are you okay?
I would say, I'm not doing horribly, but I definitely feel the stress, I guess. So I gave birth to my son on February 12th, almost a month to the day prior to locking everything down.
I think it's been a really, really long year. And there's been some moments where it felt like we might not be okay. We might not make it to December, but we're here.
I'm okay. Yeah. In general, I'm okay. Yeah. I'm trying to start a new business and it's not simple, especially in a pandemic. But at the same time, you have to look at the positive things.
I'm not seeing my parents. I'm not seeing my in-laws. Oh, it's hard. It's mental stamina, right? It's telling yourself, like, I got this, I can do it. It's hard.
I think it's very, very important to realize or remind yourself that this is going to pass. This is not forever, right?
Living with my roommates, we try and stay connected. We have dance parties in our living room. We're feeling really isolated from people, and even just like checking in with someone saying, hey, how are you doing? Are you okay? It matters so much more right now, and it means so much more right now.
Okay, if you lost your job, this Toronto restaurant owner has a message for you.
We can give them a positive experience and offer them a hot meal.
Next, why he and others are choosing to end the year on a hopeful note.
Coroner, new season this winter on CBC and CBC Gem.
This has been a hard year for so many, and for those who work in the restaurant industry, the hits keep on coming. But one Toronto restaurant owner is trying to help soften the blow just a little. When the latest Toronto lockdown was announced, Chris Meary, owner of the Dizzy, decided he'd do what he could to help out restaurant workers all over. All they had to do was call the Dizzy and they'd have a hot meal waiting. And that is our moment.
On the day that they made the announcement, I was pretty upset, obviously, frustrated. And I kind of lashed out and I made a post, and it wasn't aggressive against anyone. It was just, that maybe the government could try and do some things to help us, just this blanket lockdown. So I know a lot of these folks don't have any savings. They work so hard, they're passionate about what they do, and it just kills me to try and imagine what they're going through right now, especially at the holiday season. And it made me think, Chris, at least you still have the business. At least you still have a way of making a living and supporting your family. So what we've done is, I can't do a lot, but we can give them a positive experience and offer them a hot meal. We're getting a ton of phone calls. People want to help out. The breweries are kicking in beer. People are bringing free pop today. It's an incredible neighborhood. It really is. It's like a little village.
And so basically, he doesn't know really. He's counting on takeout and delivery to help pay the bills. He's got a great relationship with his landlord. They've been working together for 15 years. He's hanging on, but importantly, paying it forward.
And you guys should know, we can't get enough of these stories. It's stories of resolve, of triumph, like a victory in a way, right? And we could sure use them. So if you have ideas for them, send them our way on Instagram at CBC The National. The hashtag #TakeThat2020. I think we can all level with that spirit. That's National for this November 25th. Have a great night.
Good night.